So, analytical epidemiological approach or investigation is positioned between descriptive and experimental method, right? So, while descriptive studies identify pattern of disease occurrence, analytical studies seek to explain those patterns by testing the hypothesis about causal relationship between exposure and outcome. So this method involves comparing groups, typically those exposed to a risk factor versus those who are unexposed to the risk factors. So these are essential for identifying etiological factors, quantifying the risk, and guiding preventive strategies in public health. So these studies are built on the principle of comparison. So it aims to identify the risk factors, measure the strength of association, control the variables, and support causal inference when experimental designs are not feasible. So these studies may be prospective or they may be retrospective. Retrospective means we can look back over time and we cannot look back over time. So it can be done both ways. So analytical epidemiology transforms observation into explanation, enabling researchers to move from what is happening to why it is happening. So analytical epidemiology, as per CDC, it is study of determinants of disease, etiological factors that are focusing on the relationship between exposure and outcome by comparing groups. The objectives of analytical epidemiology, and it is designed to move beyond description toward explanation. So its primary aim is to identify and quantify the determinants of disease so that the researchers are able to understand why certain individuals are being effective. So these studies are essential for testing hypotheses, measuring associations, and informing the preventive strategies to the community. So here comes your key objectives, that is we are identifying the risk factors, we are testing the etiological hypothesis, measuring the strength of association, controlling the variables, establishing temporary relationships, supporting the causal inference, and guiding the preventive and therapeutic strategies. What are the features? Features are like use of comparison group, means we are comparing exposed group to the unexposed group, or we are using the case studies over the and comparing them with the control groups. Then hypothesis testing is being done. Measurement of association by relative risk, odds ratio, attributable risk. These are all statistical measures are there to measure the association. Then we have sequencing, observational nature of this method, retrospective or prospective design, statistical analysis, risk estimation, and applicability to the real world settings. So these are the features of analytical epidemiology which make them a powerful tool for uncovering the cause of disease and evaluating the impact of exposures. Then comes our types of analytical study designs. So in types we have case control study, cohort study, cross-sectional analytical study, nested case control study, then case cohort study. So particularly we have basically two, that is case control and cohort study, and then we are just making certain changes in these studies only and coming up with new study designs. So what is case control study? Case control study means we are comparing the cases to those without the diseases, like with the control group. Means one group is exposed to the disease while the other one is not exposed to the disease. So that is a case control study. So it begins with outcome and then looking backward for exposure and the causative factors which were responsible for that disease. Then comes your cohort study. Cohort study means group of exposed and unexposed individuals are studied over time and then compare the incidence of disease. Right? Means both groups are exposed and then the outcomes are also observed. So, for example, like factory workers which are exposed to asbestos and then lung disease rates are being compared with the unexposed workers or the workers of the factory who are being exposed. Means both the workers of the factory, all the workers of the factory are being analyzed. That is a cohort study, right? Then is a cross sectional analytical study. Means this study assesses the exposure and outcome status simultaneously in a population at a single point of time. So we are studying in this the prevalence of a disease and not incidence of a disease. And it is useful for identifying associations, not casualties. So serving dietary habits and obesity status among adolescents in urban schools, that is the example for this cross-sectional analytical study. Then we come to nested case control. Case control study we saw here. This case control means we are comparing the cases with the control group, right? If we are talking of nested one, nested means we are comparing the cases with the control, but we are having the defined cohort of people to whom we are studying, right? Means we have a set of people where we have just classified them as cases and then control. So it is a nested case control study. There is case cohort study. Case cohort means now the cohort system is also coming into existing, like slight variation in the nested design where sub cohort is also there, and it is used as a comparison group for multiple outcomes. So these are 5 types of study designs of analytical study. Now we have been seeing certain terms like relative risk, attribution, association. See, like here we study of relative risk. Then we talked of odds ratio. So measures of association, measurement of association things are there. So we'll study this in detail. What is this? Measures of association. Measures of association are statistical tools where we are just studying the or taking out the outcome in the uh, quantitative terms, right? So this statistical tool or these statistical tools are used to quantify the strength and direction of the relationship between exposure and health outcome. So the outcome can even be the positive, negative, or not at all. Means it can be just null association. So number one in this we talked of relative risk, the ratio of incidence of a disease in exposed group and incident divided by incidence in unexposed group. So what is the interpretation? Means if the answer comes to 1 means there is no association. If it is greater than 1, there is the risk factor is present, positive association is there. If less than 1, there is negative association, means some preventive or protective factor is also present, which means the disease is not being developed at that rate, right? So this is relative risk. Then comes your odds ratio. Odds ratio means odds of exposure in cases, odds of exposure in control. Now what is this odds of exposure means? Now odds of exposure means A upon C. If we see this relationship, then we'll come to know like cases upon control. Actually it is cases upon control, and we are just multiplying exposed with the unexposed cases, right? So exposed cases into unexposed control, then being to see you can see exposed control upon unexposed control. So this is the formula, and interpretation can be like if it's greater than 1, exposure may be there, and less than 1, so exposure may be protective, and if it's 1 then no association. Next comes your attributable risk, means the difference between incidence in exposed group minus, or you can say incidence in unexposed group. So it estimates the excessive risk that can be directly linked to the exposure, helping the healthcare professionals to determine if there is potential impact of removing or reducing any exposure or not. Next comes your population attributable risk, means incidence in total population minus incidence in unexposed group. Then again it helps to prioritize the interventions by identifying the exposure. Then comes your risk difference. Risk difference means risk in exposed minus risk in unexposed group. So particularly it is useful for estimating the actual number of cases that could be preventive if the exposure was eliminated. So these are the terms, measures of association, means we can just calculate them statistically and we can have the answers in numbers. Now, what are the steps in conducting an analytical epidemiological study? Steps means what is the procedure? Again, we have to define the research question. We have to select the appropriate study design, means what type of study design we are selecting, like case control, cohort, or cross sectional. Then we have to identify and define the study population, define the exposure and outcome variables, select the comparison group. Control for confounding means we have to apply the design strategies, use analytical techniques, collect the data, analyze the data, interpret the results, and then reporting to the professionals. Right? So these are the steps of analytical method. Now, advantages: hypothesis testing is done. Quantification of association means measures of association are being estimated. Then casual inference is being supported. Rare outcomes are also useful. They are they are efficient for studying designs with low incidence. We are also able to have the cohort study, so we are having the follow up of exposed population. Real world applicability can be done, flexible design options are there, and yes, of course, policy making and intervention techniques can be very easily done by this method. Limitations: that limitations include, like there is susceptibility to bias, means there can be selection bias, there can be observation bias, and this can directly affect the validity of the results. Then always it is not able to establish causality, means temporality is unclear. Okay, so if we are talking of that this exposure is temporary and it will give you temporary outcomes, so sometimes it is not always true. Then is data quality dependence is there. Time resource incentive, means time taking is there. Follow up and substantial funding is required. Ethical constraints are also there, and it is limited for rare exposures, means uncommon exposures can just affect it retrospectively, right? So these are certain limitations of analytical method. So here we have the comparison also. This is the comparison table, just a summary type of thing. That descriptive method, we are just describing it in terms of person, place, and time. Analytical method, we are testing hypothesis and identifying the association between exposure and outcome. While experimental is, we are evaluating the intervention by manipulating the exposure and observing outcome. Design type means cross-sectional design can be there. Here it is case control, cohort, and cross-sectional. It is RCT, field trial, and community trial in experimental method. Now, for the analysis, we have a population or a group, we have individual or a group in analytical, while individual or a group in experimental. Exposure control, there is no control under observation studies, we are just observing them. There can be no manipulation in analytical, while investigator controls are there in experimental methods. So, this is your methods of epidemiology.